600 doctors wrote to the president on Tuesday warning him of the fallout of keeping lockdown measures in place. They called it a mass casualty incident, meaning there are more victims than resources available to help. Psychiatrist Dr. Lieberman says there are other health consequences to the lockdown that need to be considered.
There are people committing suicide. There's child abuse. There's domestic violence that has increased. All of these things. So there are consequences, and they have to be weighed along with these numbers of people, being admitted to the hospital or ICU and so on.
The doctors wrote the lockdowns are causing 150,000 Americans a month to miss out on early cancer detection. They also cited a 7-fold increase in calls to suicide hotlines since the lockdowns began. Dr. Lieberman referenced studies that show people who watch the Twin Towers fall over and over on the news developed post-traumatic stress disorder. She says staying home and constantly watching the news about the virus is no different.
We're watching the news of how many people are dying, and we're watching, other kinds of frightening, life-threatening things. And it's happening to us, too.
Dr. Lieberman cautions against following the CDC's strict guidelines on reopening. She says it may take too long to get the infection parameters low enough to satisfy their requirements. Meanwhile, people are suffering from the harmful effects of isolation.
And those conditions alone can cause physical and psychological problems, from heart attacks physically to anxiety, depression, suicidal ideation. So staying at home is not without consequences.
In the meantime, she says it's important to be creative and use the downtime to read a book you never had time for or catch up with old friends. Kevin Hogan, NTD News, New York.